And as we spend most of this afternoon's debate speaking of the goal to end new HIV transmissions by 2030, I feel it's important to recognise just how far we've come in terms of our understanding of HIV and treatments for it, and our education and awareness raising of it, because we've seen so much progress in the fight against HIV since the 1980s crisis. And whilst there is still a way to go, it is through open discussion, such as the one we're having today, that we've been able to reduce the number of HIV cases in the UK down to an estimated 113,500. But it is thought that, as you've heard already today, that 4,700 people are unaware that they are living with HIV. And that is why it's vital that we continue to push to increase testing, because we know that when caught early, HIV is treatable and the quality of life of those living with HIV is far better than what it was back in the 80s. But it's the unknowing carriers that not only risk not getting the treatment they need or getting it too late, but they also risk unknowingly affecting others. Testing is easy, it's quick, and it can save lives. We also know that testing among men who have sex with other men is high, and this is incredibly encouraging, but we must do more to increase testing among heterosexual men, heterosexual and bisexual women, and the trans and non-binary community. The stereotype that HIV is only something that affects men who have sex with men is not true. In fact, the increase in infections in 2023 was attributed to sex between men and women, with a 35% increase amongst heterosexual men and a 30% increase amongst heterosexual women. So we should be doing more to encourage testing amongst all groups. And that means greater investment in local and community-based public health initiatives. So I'm really pleased that this is what this government are doing, investing in local government public health. And I'm particularly pleased to hear about the £38 million which is being awarded to my borough of Lambeth, which will go a long way towards supporting people with HIV and preventing HIV, as well as funding other vital public health initiatives that the borough runs. My honourable friend spoke earlier about the important role that councils play, and it is a crucial role indeed. It encourages testing, and councils are well poised to target the communities and areas where, with increased awareness and tailor messaging in the way that it is needed. Now, the work of local councils and community-based organisations has really helped to increase testing rates and reduce stigma, and it's also helped to ensure that as many people as possible know their HIV status. And with this recent round of government funding, it's going to go a long way to continue supporting that work. But I do hope to see more from this government on the international front, actively looking to support international efforts to stop HIV transmissions, especially at a time when President Trump is running his reckless review of American aid and has put the future of the US President's emergency plan for AIDS relief in the balance. Any credible attempt to end HIV transmission must include a global response. And when it comes to ending HIV transmissions, we are not an island. Ending new cases here will only last for so long if we're not contributing to efforts to end them abroad. So where the US is stepping down from efforts to tackle global HIV transmissions, we should be stepping up. As it stands, we're already not on track to reach our target of ending new cases by 2030, but I hope that today we will hear some insights from the Minister on the steps the government is taking to increase testing and end new cases in the UK and abroad. And I very eagerly await, as I'm sure other honourable members will be also, the government's new HIV action plan later this summer.